Concepts reviewed. Blood alcohol concentration is determined by the concentration of alcohol in the drink, the rate of drinking, the rate of absorption, the rate of metabolism, and a person's weight and sex. Now, the rate of absorption is also affected by food. It will absorb slower if a person is actually eating. The amount of alcohol the liver can metabolize per hour is equal to about 0.25 ounces of whiskey, 4 ounces of wine, or 12 ounces of beer. Meth or methamphetamines is an easy to make street drug that users swallow, smoke, snort, or inject. Repeated meth users often lose weight, get skin sores, and have dental issues. They usually lose a lot of their teeth, mostly in the front, because whatever that drug is made out of, it destroys the teeth enamel. High internal temperatures followed by a rapid heart rate would indicate a need to call an ambulance. That's an emergency. So if someone is using meth or methamphetamines and their temperature is really, really high, they have that increased heart rate, then it is time to call an ambulance. It's time to seek emergency services. Vulnerable populations often have poor health outcomes, high levels of communicable diseases, and because of their living conditions, they're exposed to high crime and violence. Vulnerable populations often have poor health outcomes compared to other people in terms of morbidity and mortality. These groups have a high prevalence of chronic illnesses, such as high blood pressure, kidney disease, and high levels of communicable diseases, for example, of STDs, hepatitis B, and tuberculosis. They also have a high prevalence of upper respiratory infections that also includes the flu or influenza. They also have a higher mortality rate than the general population because of factors such as poor living conditions, diet, health status, and crime and violence, including domestic violence. So the three key things for vulnerable populations is they often have poor health outcomes, have higher levels of communicable diseases, and because of their living conditions, they are exposed to more crime and violence. Pregnant homeless women present several challenges. They have higher rates of sexually transmitted diseases, higher incidences of addiction to drugs and alcohol, poor nutritional status, and higher incidences of poor birth outcomes. Thus, being homeless is the most dangerous sign of those. However, the most concerning for homelessness presents challenges for people that female that is actually pregnant and homeless. A direct correlation exists between poverty and poor health outcomes. Poor teens are nearly 3 times more likely to drop out of school as their non-poor counterparts. When programs that assist a mother to complete her education are instituted, chances are increased for a better future. That's a long-term health outcome that improves healthcare over the long term across a lifespan. It is also important to keep the pregnant adolescent in school during the pregnancy and have her to return as soon as possible after the birth. So a long-term goal, and what you really would want, is for that child to finish school, to return to school, complete their education. Some short-term health outcomes are teaching about body changes, proper care of the baby and parenting, and then monitoring the teen to detect early problems in pregnancy. Those are some short-term health outcomes. Nurses have we have an ethical obligation to provide culturally competent care to the LGBT families. We must first understand our own feelings when providing care for this population. It may be important for the nurse to investigate same-sex marriage laws and family structure. Therefore, that helps add to your knowledge base. Sometimes nurses may feel a discomfort when discussing sexual orientation with their patients. However, it is important to overcome this barrier to actually provide care. You must still provide care for the LGBT families. So you want to provide a safe environment for the patients and you to discuss sexual orientation. But we first must be true to ourselves and own our own feelings and understand what it is that we're feeling and add to our knowledge base by looking up those laws and seeing so that we can act appropriately, provide the best resources for our patients. So if a nurse is providing is a father has confided in you as a school nurse. You know, you as a school nurse, you'll be the counselor, the nurse for the students, the faculty and staff, and parents. And sometimes more than they will confide in you um about all different things. So if a parent confides in you about their child kissing someone of the same sex, the nurses we should reply with some of these conversation starters. Homosexual behavior in adolescence is not uncommon. Adolescents often desire to explore alternative lifestyles. And then you should encourage the parent to seek a support group. These are all things that will help you get, more information and establish that trust with that parent so that you can have that conversation that might be uncomfortable for you and also them. Beyond environmental cues and LGBT inclusive policies, clinicians can also make strides in improving the health of their LGBT patients by fostering a welcoming environment within the examination room and by educating themselves about LGBT health topics. We want to take an open, non judgmental sexual and social history. This is key in building that trust with the patient rather than making assumptions about patients based on their appearance or sexual behaviors. We should ask open-ended questions, mirroring the terms and pronouns patients use to describe themselves. For example, rather than asking a patient, "Are you married?" or "Do you have a boyfriend or girlfriend?" consider, "Do you have a partner? Are you in a relationship? And what do you call your partner?" Such questions, this helps open the dialogue and establishes that rapport and trust. Adolescent pregnancy outside of marriage can arise from a female that may or may not have low self-esteem, fears of inadequacy, and desperation to escape from an abusive and dysfunctional family. So we want to use therapeutic communication techniques. And that usually is a restatement and repeats the main thought that the patient or the client has expressed. This assures them that you, as a nurse, are listening in an attempt to validate and understand what they are telling you. So, psychomotor learning is dependent on the learner's meeting three conditions: having the necessary ability, including both cognitive and psychomotor abilities, having a sensory image of how to carry out a skill, having opportunities to practice that new skill. So, the characteristics that a learner must possess to successfully master psychomotor learning, excuse me, opportunities to practice that skill, and the necessary ability to perform that skill. So, when we talk about learner related barriers, we want to keep in mind that the patient or the client might not want you to know that they have a learning disability or they're not really understanding what you are saying. So, you want to be sure to, establish that trust, that gain that rapport up front, so that if they have low literacy or not understanding what they tell you, that they will say, hey, I'm not sure what you're talking about. But some statements, but just listen out for some things that they might say. They may try to, if, for example, if you're giving them a pamphlet to read or some information to read, they may say things like, oh, I don't really like to read. Just tell me what I need to know. That is a mechanism that they or statement they might say to avoid saying that they really can't read or have low literacy. So, but by establishing that rapport trust up front, hopefully the patient will tell you, hey, I just can't read. But be mindful of the things that a patient might say in order to get around reading something that you are giving them, some information that you're giving them that's in writing. And so you will need to actually go over that information, or maybe find a resource that actually would read it to them. And so and also if you think that the patient or the client might have low literacy or problems with reading, you might ask them, hey, would you read this right here to me, and you read it and then we'll discuss it. So that will give you an opportunity to see if they actually can read or are having difficulty. Because just because someone graduated from high school does not guarantee that they're actually comprehending what they're reading. So the person might can read the statement or the pamphlet or the sentence or the paragraph, but then if you have a dialogue or conversation with them, it will indicate you will understand whether or not they really they understood what they read. So that would be an indication of low literacy. You want to encourage your patients, like I said, to, that you let them know that you're there for them so that you can gain their trust. And, when a patient lacks self confidence, we need to explore the patient's feelings. you know, Ask them, hey, what bothers you most about whatever it is, the concept. For example, if you're teaching them how to do self administrations of insulin injections, have that conversation. What bothers you most about, giving yourself that injection? Not all clinicians can become experts in LGBT health, but we should learn to address some of the specific health concerns of the population. So training about LGBT, um, right now the information might not be so readily available, but we should, try to look at resources so that we can gain more understanding about it. The American Nurses Association has formulated general guidelines and standards for nursing practice. They are broad and in general in nature and apply across the nation. So those guidelines from the American Nurses Association, they are not specific, they are broad. And from those guidelines, healthcare entities write their policies and revise their policies based on those standards. Many times, once you get to work at your places of employment, they'll have different committees that you might can work on. And so a ethics committee is one that you might be asked to serve on. The purpose of the ethics committee includes processing ethical dilemmas, providing education, and providing policy recommendations in case consultations. All types of things come up. And then the ethics committee is a committee that is common to most healthcare businesses or practices, because you just never know, what issues would arise. And they go to that committee to talk it through and just make sure that they're looking at everything from A to Z. And from that they write policies and stuff, and that guides their practice. When we are taking care of patients that are considered terminal, we need to focus on the needs of the client, keeping the client comfortable and maintaining dignity and self-esteem. Family needs are important, but the client's needs are the most important. Prescribed treatments need to be carried out, but making the client comfortable and maintaining dignity, that is priority. When we are taking care of a hearing impaired client, we need to ensure that we, the nurse, we are speaking by providing adequate lighting. We want to make sure that we're standing in front of the client, and we want to enunciate, pronounce our words clearly, but do not exaggerate lip movement, because most of the times they might be reading your lips. If the client is profoundly hearing impaired and using signing, a sign language interpreter should be obtained. But otherwise, we want to speak clearly and do not exaggerate lip movement. We want to ensure that there's adequate lighting and that we are standing in front of the client. It's important to speak in a normal tone. You want to avoid shouting. The nurse should talk directly to the client when facing the client and should speak clearly. If the client does not seem to understand what is said, the nurse should express it differently. Move closer to the client and toward the better ear to facilitate communication. A client who is aphasic having difficulty expressing or understanding language. A client who is aphasic has difficulty expressing or understanding language. The nurse should face the client when talking, establish and maintain eye contact, and speak slowly and distinctly. The nurse should use gestures when talking to enhance words and use body language to enhance the message. Then we should give clear directions using short phrases and simple terms, and phrase questions so that they can be answered in a yes or no, with a yes or no. If there's a need to repeat something, the nurse should use the same words a second time. This is when we're talking about a person that is aphasic, having difficulty expressing or understanding language.